Hi, good afternoon. The name is Anna Mensah, your mobile nurse. So this evening I'm here for us to talk about administration of inhaler as one of the stations you can get during your OSCE practical exams. So administration of inhaler, we all know every procedure comes with some steps. That is, those steps run through each procedure. That if you remember, we have already gone through those steps. Hand washing first, scene safety, then approaching the patient and you introducing yourself. Those steps are always constant in each practical procedure you get. So with the administration of the inhaler, that one is also constant. It will still have to come. So what I want us to talk about is not the general procedure, no. Some salient point I think you need to know when you are preparing for your OSCE and when you want to pass the station of administration of inhaler once for all, then you need to pay attention to it. The first point that I want us to know is the scene safety. That you have to most scenarios they will tell you the patient is within his comfort of his home. So you have to visit, like you are visiting the patient to administer the medication. And in other scenario, if you are fortunate, they will tell you within the healthcare facility. Then that one. So if the patient is within the comfort of his home, you still need to verbalize scene safety. When you enter, let's assume you're visiting the patient in his house. You knock, you enter. How do you ensure that the scene is safe for you to approach? So you ask the patient, is there any dog? Do you have any dog in the house? The person will probably say no. Then you tell the patient if he's comfortable, can he close the windows and lock the door? That is you ensuring that the scene, that is the environment that in which you're going to operate, is safe for you to approach. That's scene safety. Another thing that I would like to talk about when it comes to administration of inhaler as an OSCE station is confirming the medication sheet. If you have ever gone through the drug administration, we need to confirm the medication sheet. So this part, you just pick the medication chart. Look at the name on the medication chart, compare the name on the medication chart to the patient wristband and see if those names tally. So let's say the patient name is Peter Johnson. So Peter Johnson, date of birth 6 July 1990, 6 July 1990. The patient is allergic to penicillin. So you can tell that. So you are confirming the scene safety. You told the examiner I can be sure that I have the right document for the patient. That is, you confirm the medication chart, that you're having the right medication chart for the right patient. Then the next thing that you need to do is confirm that the prescription is valid. So here, how do you do it? You look on the medication chart, look for the prescription name, the prescriber name, his blip number, and then his signature. If those things are showing, then that means the prescription is valid. Then you look for the date and the time, and then the dosage. So mostly the date could be, let's say you are in to serve the medication today, but the date was yesterday. That means the prescription is invalid. That means you have to draw the prescriber attention for him to re-prescribe. So the name, the date, the prescriber name, and his blip number, and then the signature of the prescriber. This information will tell you that if the prescription is valid or it's not valid. Then another thing that you need to do is you serve the inhaler with a spacer. A spacer is more like a bottle which have two openings. So you connect the inhaler to one of the end, and the client will put one of the end into his mouth, where it will aid him to breathe in medication. And this spacer is to ensure that enough of the medication gets into the patient's lungs, not instead of he putting the inhaler in his mouth and pressing it, which will land a lot of medication in the patient's mouth. So how do you do it? You check the dispenser, ensure that it's dry, it's clean, there's no crack on it. That's one. Two, the expiring date of the dispenser have to be within 12 months. So if the expiring date is more than 12 months, you need to go for another dispenser. So tell the examiner, I could see that the dispenser is clean, dry, there's no crack, and its expiring date is within usage. That is if it is within 12 months. Then we tell the examiner its expiring date is within usage. Then another thing that you need to do is look for the expiring date of the medication. That is very important. So you pick the medication, you check if it's let's say the brand of medication the prescriber give. So most popular medication that it uses salbutamol inhaler. So salbutamol inhaler, you look on your prescription sheet, salbutamol inhaler. The prescriber may prescribe 2 puff. 2 puff is equal to, let's say, 500. The examiner may prescribe 2 puff. So 1 puff is if the examiner prescribe 500 microgram, and the medication comes in dosage of 1 puff is equal to 500 microgram, and the examiner prescribe 1 gram. That means you have to give 2 puff. Pay due notice of that. If you don't verbalize to the examiner that the prescriber gave 1 gram and the medication at hand comes with 500 microgram per puff, so I have to give 2 puff. If not, that one will lead you to fail. Another thing that you need to know is the obstruction that could happen within the inhaler, the salbutamol itself, the medication itself. So how do you go about this one? So after that you dismantle the inhaler, take off the medication, and there will be the container holding you. Check if there's any foreign body in it. If there is not, put it back and shake it for 2 to 5 seconds. I'm not going through this systematically. I'll do that in the next video, but I'm just bringing out salient point that you need to draw attention on it, unless it could lead you to fail your exams. So ensuring that there's no obstruction in the inhaler, you take off the medication itself, leaving the container, see if there's no obstruction, insert the medication back and shake it 2 to 5 seconds. That is another thing that you need to pay attention to it. Then you have, let's assume you have handed over the medication to the patient. What you need to do is explain the breathing technique to the patient. We have 2 breathing techniques. You have the T-dive breathing technique, and you have the T-dive breathing technique. And the single breathing technique. So you have the T-dive breathing technique and the single breathing technique. So the single breathing technique, this is how it goes. You tell the client that he should put medication, the dispenser in the mouth, inhale for 5 seconds, hold the medication within hold his breath for 0 to 10 seconds, take off the dispenser and exhale to a pierced mouth. So to a pierced mouth means exhale whilst his mouth is kind of closed like this. So that's the pierced mouth. So you tell the So you explain to the patient the need for the use of the dispenser. So you tell the patient why is it important for him to use the dispenser instead of using the inhaler directly. So you tell the patient that the dispenser will help the medication, let's say 80% or much of the medication to get directly into the lungs, instead of using the medication, the salbutamol directly on the mouth, which will dispose most of the medication in the patient's mouth. So that's why they introduce the dispenser. The dispenser will help a lot of the medication gets directly into the lungs. So that's the need for the use of the dispenser. Then another point that you need to know is the breathing technique. As I've earlier mentioned, that we have the single breathing technique and we have the T-dive breathing technique. That is multiple breathing technique. The single breathing technique, you tell the patient to hold the breath, put in the dispenser, press the medication, and breathe in for 2 to 5 seconds. Press the medication, breathe in for 2 to 5 seconds, and then hold his breath for 0 to 10 seconds, then exhale through your pierced mouth. So let's say, let me show it to you. So let's say I'll insert the dispenser in my mouth, press the medication, breathe in 2 to 5 seconds, hold my breath for 10 seconds. Then I will exhale through a pierced mouth. That will be, that's the single breathing technique. The multiple breathing technique, or teeter breathing technique, you tell the patient he can breathe in and out for continuous 5 times, and exhale through a pierced mouth. So the patient put in the inhaler dispenser in his mouth, press it, breathing through the mouth, and exhale through the nose continuously for 5 times. Then take off the dispenser, and then breathe out through the pierced mouth. That's the 2 breathing techniques. Then ask the patient which of them is he comfortable with, or is it okay to do. He will tell you which one, then you encourage him to do. So if the medication prescribed is 1 gram, and medication comes in the dosage of 500 microgram, that means the patient have to go for a second puff. So in this instance, if the second puff is the same medication, the patient, you can wait for 30 to 60 seconds, then you introduce the second puff. But it is a different medication, you need to wait for 2 to 3 minutes before you allow the so if it's a different medication, you have to wait for 2 to 3 minutes before you introduce the new medication. So let's say the examiner prescribed salbutamol, and he prescribed a different medication. So if the different medication is what the patient needs to, what you need to give as a second medication, you have to wait for 2 to 3 minutes. Then ask the patient to breathe in. After the procedure is done, the most important thing, make the patient comfortable. Ask him if is there any other thing he need to do. And since most of this administration failure, most of the scenario is being done in the patient's house, tell the patient he can wash the dispenser with water and keep it dry, and air dry it and reuse it. So it's exceed the 12 months. Then tell him how he will store the medication out of direct sunlight, and how and the medications also have to be kept out of reach from children. Then document your medication, you chart the medication itself, and you sign against it. Then you apply your alcohol, wash your hands, and that will be the end of your procedure. So this is Nana Mensah, your mobile nurse. If you are individual that you are looking for materials for OET, OSCE, and CBT, you are international nurse, Ghana, Kenya, Benin, which other African country you are coming from, and you're looking for materials or you're looking for help to start writing your UK nursing exams, please keep in touch. We are so happy to help you start your journey and help you write your exams. Stay blessed. Thank you.